there's the diet vile unafaa kukula before,
yes,
during, and even after delivery. Okay. So there's the foods to there are the foods to really focus on. So for example, preconception, you're planning to get pregnant.
yes.
So increase the iron, the vitamin B12, vitamin D, folate, iodine in your diet. Okay. First trimester, iron, B12, protein, vitamin D, protein and fats. No. Proteins, second and third trimester, proteins, fats, carbohydrates, iron, calcium, vitamins. This is just a generalized kind of way of saying it. When you're breastfeeding, lots of proteins, lots of fats, calcium, iron, and vitamin D.
Yeah.
So like this is a plan, so those are the discussions that you want, that it should be part of the discussions that you have with your daktari ukienda clinic.
Yeah. Welcome back to The Heart That Changed You, and welcome to Nina's show. I'm your host, Nina, and I'm so excited. Hey, Manze, thank you so much for the comments, the questions, your stories. Manze, mna comment huko chini, and thank you so much to Jacinta for bringing light to something that we have seen. It has been so much in the silence, and now we need to bring it to light. We need to have an understanding of what is really happening. Yeah, so today we have a different twist on the show, and we welcomed a doctor to tell us what happened, what is really going on in a woman's body when they are pregnant, what determines the BP to be high and low, what is the highs, and what are we supposed to do when it's this high, or how high is highest. Yeah, so thank you so much for joining. If you have your questions, please drop them down below. We see them, we read them, and we make sure that we get an expert to explain, because we cannot know everything, Cynthia. Yeah, so welcome, Dr. Collins.
Asante sana, thank you for having me.
Maybe you can tell us your credentials.
So my name is Collins, Indiya. I am a clinic officer specialized in reproductive health. Yes.
Thank you so much for joining. I know you heard about the Jacinta story.
Yeah, I did.
Yeah, and it had a lot of concerns, and a lot of people, actually I think a lot of women who have gone through such a tribulation, it has been painful. It did not end up as joyful as Jacinta's.
Yeah.
So maybe you can tell us, what are we supposed to be keen on when you're pregnant? Does it determine what you were eating before you got pregnant for the BP to be normal, high, or low?
Okay, so when it comes to blood pressure, instead of we'll look at something called risk factors. Like these are the factors which predispose you to getting high blood pressure. So for example, the age, in terms of genetics, if there was people, how can I call it? Not predecessors, your parents or relatives.
Yeah.
If it's something in the family, or for example, kama your preeclampsia, did you have it previously? And also, we are looking at more of predisposing factors. But yes, there's a way you can prevent, not really prevent it, because this is more of a lifestyle illness. So it's either uko nayo ama hauna, Yeah. But then now it's what can I do to maybe avoid? So let's check maneno ya lifestyle changes, nutrition, physical activities, things like that. So there is no particular cause,
of having it. So let's say, for example, someone was just okay, and then once you just get pregnant, there are many cases of once I just got pregnant, because in her story she said once the baby just got out, the headaches disappeared. What is that thin line? Because I feel like we do not understand it.
So when it comes during pregnancy, there are changes which occur in a woman's body. Now, because of those changes, there are things which are affected naturally. So not just maneno ya ati size or weight inaongezeka. No. There are other things which go on inside. Now, because of the placenta, the presence of the placenta and other hormones, they can contribute to the blood pressure rising. Not just that, also kuko na risk ya kupata, we call it gestational diabetes. There's also I'm forgetting the other one. So it's hypertension and diabetes. Oh, and also pregnancy is in a woman pregnant in that stage, she's immunocompromised, meaning her immunity imeenda chini kidogo. So you can imagine all those changes, all the risks. So pregnancy in itself is a risk factor for getting high blood pressure, you know, or in pregnancy. All right. But now sasa ukiongeza hizo zingine histories and maybe she's already she's already predisposed because of other factors. So mapata no risk inaongezeka.
Maybe you can explain to us in a layman's language what is high blood pressure.
Okay. So high blood pressure or hypertension is just the elevated blood pressure. Okay. So zikipita a certain number, if I may put it that way. So it depends with it's classified, and fortunately or unfortunately it changes very much. Kama ukiangalia 2018 na sahi, I'm not sure zinafanana sana. So they break down in terms of age. The older you grow, the more naturally mtu ana pressure zake zinapanda. It's natural.
Interesting.
So inakuwa ni natural. So tukipata for example a 60-year-old akona na pressure ya 141 over 80, that's okay. That's pretty much okay. As long as isikuwe ati ni alikuwa na history ya hypertension. Unaona? Hata okay 141 138 hapo, you know. So according to age, so kuna yenye ilikuwa between 110 to 120 to 129, 130 to 139. So as from 140 ndio sasa tunaanza consider, okay, this is ni kama ni hypertension inaendelea hapa. Okay, ukiona inaanza kukaribia 140 sana, okay, hapa by the let's be keen here. Ya chini isipite 90 or rather yes, isipite 90. So 140 90 hapo sasa ndio kidogo tutaanza kushuku maneno ya hypertension.
If you have any questions about reproductive health, please comment down below for him to come back and teach us more, because I feel like we have a lot to discuss, especially when it comes to reproductive health. But right now we will focus on the story from the statistics of that story. So does having high blood pressure happen to be from a certain body type or gender?
No. No. Yes, as a back to risk factors. So for example, like our race, like the dark-skinned people, we are more prone to getting hypertension than whites.
Why?
Genetics too.
Wow. Okay.
So there's that. There's the history, like I've mentioned. There is the lifestyle, obesity. If you have kidney diseases, also it can contribute. You know, so back to risk factors. You know, it's with lifestyle illnesses, it's usually quite hard to say this is the cause. For example, malaria, we'll know the kinanini plasmodium, you know, but then sasa hypertension, hakuna bacteria ama virus enye inaleta ama parasite, you know. So sometimes it gets hard and to know ni nini shida.
Na mtu akiwa na rhesus factor, is it rhesus? Does that determine as well?
No. That's a whole other topic.
We
call it rhesus incompatibility. That's a whole other thing about blood and no, they're not related to hypertension.
And can someone have hypertension and the body is fighting the baby?
Yes. It is very, you know, when you learn about something, you only think that in hypertension, for example. And then kwa ground, huyu mtu akona hypertension, akona history ya diabetes, na bado ni rhesus negative.
Yeah.
So inakuwa tricky but manageable.
Yeah. So when is the right, okay, you cannot specify when is the right time to get the baby out when it's really dangerous?
So when a pregnant lady comes and akona preeclampsia, okay, so allow me to kind of break it down so that I can give maybe manena severity.
Yeah.
The first one let's call it gestational hypertension. You did not have hypertension before getting pregnant, alafu ikaingia but during pregnancy, that is gestational hypertension. And then it graduates inaweza graduate ikue preeclampsia. Now preeclampsia ni sasa hypertension plus some features.
Yeah.
So like Jacinta alikuwa amefura. That's one that's one of the signs we look out for. Okay, we call them severe features. So for example, headaches, blurry vision, abdominal pain, ni kama heartburn. Na blurry vision, headaches na kufura. So hizo zingine sasa ni sisi tuna test kama proteins in the urine and urine output. That's why wanekangwa catheter because the kidneys are in danger. The chance of kidney failure zinaendelea zikipanda. And then we graduate to eclampsia. Eclampsia now is like the worst kind because now sasa convulsions get in. Someone
and
who
you're pregnant.
Yes. Someone who never had any history of convulsion, epilepsy or anything. So the high blood pressure has become so bad that ikaleta complications, convulsions. Now, so that's how let's work with those with that breakdown. And after I think maybe I can be able to answer the questions easily.
So maybe mwenye hajakuwa severe bado, mwenye hajafika place ya kukua na convulsions, when is the right time or what do you monitor to see that we have to take the baby out now? Because for Jacinta's case, this is something that just happened within 2 weeks from her story. But it got to a point after she got the transfer to the next hospital, she was told, relax. And then in the next 2 days, we have to get baby out.
So, unfortunately, most of the time, when a lady comes in, ni kitu inakuanga ya kushtuka. Tumepima pressure, kwani unakuanga na pressure? Hapana. Na ukoaje? Niko sawa, sisikii kitu. But then unaangalia hizo pressure, hizo ni pressure enough kukuweka chini, you know. So there's no like timing, like kuja at this number of weeks. So tukipata, we immediately start management. And the I don't want to call it cure, but the immediate solution for high blood pressure in pregnancy, which is endangering the life of the mother and the baby, is delivery. But now sasa tunaangalianga like the ako wiki ngapi, can we be able to push? That's the thing. So for example, I'm not really sure history yake vile ilikuwa inaenda Jacinta, but ni ile like trying to push to as near term as possible. Okay. So it's about pushing to near term so that asikwe premature sana, you know, because as we all know, the more premature the baby is, the less the chances of surviving. So we try a lot to push to term. But ikifika point pressure hazishuki, dawa haiski, and sasa in the fetus now is in danger. Sasa delivery is the only option. Yes.
Wow, okay. Now the other one, now I think now the severe one.
Now this
eclampsia.
Eclampsia. Now eclampsia, it's immediate. Like you hakuna kungoja. Stabilize the patient and then delivery.
No matter how small the fetus is.
Now this is when there's a clause in the constitution that allows for termination of pregnancy if the pregnancy endangers the life of the mother. So there are those cases that the life of the mother is in trouble, is in danger rather. And if delivery does not happen, you will lose the mother and the baby. So hata kama ako premature sana, yes, tutamweka kwa nursery. But knowing very well that the chances of survival are very low. But then kumbuka, kuna ile wiki yenye you can't, iko chini sana. So either way, hata akideliver itakuwa shida. You know? So it gets, every case is, each case presents differently, and we handle cases individually. You know? So there is no one size fits all for this.
Now, once the baby survives, because we pray they survive, does the baby automatically, does that what the doctors say genetically? You are genetically from blood pressure?
So like this baby may survive.
Genetic,
So akigrow atapata hypertension. We might not know.
Until that time comes.
Until that time comes. We pray akwe sawa, but we might not know. Especially if it's a lady, especially, yes, itakuwa poa akwa ajiangalia. Even a man, you know. But with genetics, it's hard to know. It's hard to know. You might get that trait, you might not get that trait. Inaweza kuruka, iende mtoto wako. You know, it's kind of hard with genetics unless, you know, like you have proper knowledge, proper research about it.
Because, okay, now people are saying they are woke. They understand what they are doing. They know, I'm going to get married to a rhesus factor man who is positive, a man who does not have diabetes, and all those things, health-wise. Does that put you aside statistically from being part of the statistics of a pregnancy that has blood pressure that is high or low?
Yes. To be honest, yes. Like if you're, sometimes if you approach life scientifically, kuna mashida utahepa.
Yes.
You know? So you know which kind of spouse you'd like in terms of the physical traits, not just the tall, dark and handsome, but hana conditions, you know? Hakuna history ya hypertension home, diabetes, hakuna history ya cancers, mnafanana the rhesus factor. So kama ni OO ni sawa, kani positive ni sawa, kani negative ni sawa bado. So that, yes, it can help. It can really help. But I mean, let's be honest. Nani kwa date anaulizanga what is your rhesus factor?
Tuwengi wetu hata hatujui.
Yeah.
Oh, interesting. So that's right. So statistically, okay, in the Kenya, okay, kwa nini IKCC in Kenya, it's the one place where when a woman gets in that delivery room, you are not sure if you will come out alive. Because I feel like Kenya is one of the, like we have those cases. Zinaendanga, sometimes someone comes and controls, and then zinarudi. So
like in terms of controlling the blood pressure, the death.
Either of the mom or the child.
Now, I cannot speak for the medical fraternity. But sometimes there are those unfortunate cases, I will not lie. Of, yes, there are those times the negligence. Sometimes it's, no, we did our best, but ilikata. What I know about maneno ya, like the maternity, what happens inside is, as long as wewe when you unapeana hiyo service, you as the medic, you should know what you're doing. Which, I mean, we were all trained to do it. And it's up to us to be able to take care of this client in a way that watakuwa sawa. You know, both of them are gonna go home wakiwa sawa. You know, hawatoki na stress or ni mmoja anaenda home or hakuna mwenye anaenda home. No. So hiyo tu, it's very individualistic, like wewe, like fanya kazi mzuri. You know, we can't really blame the system entirely. You know, for example, kuna shortage of equipment and all that. then refer. You know,
don't wait.
Don't wait. You can refer, and if the referral process is tricky, ambia to the client, we can't like enda hosi flani, you know.
Okay, at least we have learned something. We have known that go to hospital and facilities zenye ziko,
and you know. So this is the thing with the pregnancy journey. It's something that you have to plan. The ideal time for starting clinic is even before you get pregnant. As you're planning to get pregnant, go to your gynecologist, go to your clinic, whichever place you go, and waambie daktari, we are planning to get pregnant. We want to start trying to get pregnant. What advice in terms of nutrition can I get? And then you get pregnant, start clinic, and then clinic starts immediately. That line inakuwa mbili.
2 lines.
Yes.
Go to the clinic.
Hapo sasa unaanza clinic. So kutoka hapo, it's ideally you should go to clinic at least 6 times.
Till 9 months.
So watu wasemanga 9 months, but actually 36 weeks is still premature.
True.
So it's 10 months, 40 weeks. Yes. So at least 6 times visit, ndio at least upate the optimum care, if I may put it that way. Yeah.
Okay. So how long so I know you're not specified in being in the NICU, but taking care of those babies in the NICU, does that determine on how the baby will come out from the endangerment of life?
Definitely. See, so mtoto amezaliwa, they're very small, very fragile. How you take care of them, will determine if they survive or not. You know, the other factors, the factors of hizo factors zingine aside, like where you're presented with this baby, you need to take care of them. So obviously, yes, kuna hiyo incubator, kuna joto poa, if they need drugs, are they being fed? You know, is there someone who's caring for them? You know, you can't really, there's no one at ukikosa kufanya hii ndio shida. No, it's a number of things.
Well, hey, hata kwanza nimeluza train of thought kwa sababu the question, I think the worriness of most moms, mtoto akiwa kwa NICU ni the 2 pipes, kuna zenye ziko kwa mdomo, kuna zenye ziko kwa mkono, hadi kwa miguu. Okay,
unfortunately, that is part of taking care of them. So for example, the IV cannulas, hizo mashindano yameko kwa miguu, zingine kwa kichwa, it's to have access, venous access, because ni dawa tunataka kuwapea. For example, the best ones are intravenous, tunapea through the vein, so lazima tuwaekee hiyo. The veins are usually small, quite small. So unaona mtoto mdogo, but they do have veins. Shindano zinakuanga ndogo. Okay, hiyo tukikuwekea wewe itakuwa, haita deliver vizuri, you know, but for them they're very tiny ones. They usually mostly purple, zingine yellow. But and then sasa kuna kole oxygen, kuna wengine sasa they have to be fed through nasogastric tube. So it's part of taking care of them. Si ati tunaumiza, tuaumizi. But unfortunately it looks ugly, it looks painful, but no. They are not in pain. Okay.
Now when you've been set aside to have high blood pressure, does diet matter?
Yes, diet does matter.
Okay, tunaambiwa tukule balanced diet, but in some cases naonanga ni kama when you overdo balanced diet in pregnancy, sometimes might this be a problem?
Now, I'll have to, there's something I was checking. There's the diet vile unafaa kukula before, during, and even after delivery. Okay. So there's the foods to they are the foods to really focus on. So for example, preconception, you're planning to get pregnant.
Yes.
So increase the iron, the vitamin B12, vitamin D, folate, iodine in your diet. Okay. First trimester, iron, B12, protein, vitamin D, protein and fats. No. Proteins, second and third trimester, proteins, fats, carbohydrates, iron, calcium, vitamins. This is just a generalized kind of way of saying it. When you're breastfeeding, lots of proteins, lots of fats, calcium, iron, and vitamin D.
Yeah.
So this is a plan, so those are the discussions that you want, that should be part of the discussions that you have with your daktari ukienda clinic. Yes, as much as unaangaliwa pressure, mtoto anaskizwa, unafunzwa danger signs, what to look out for, there are other things that at least ziziko included. What should you eat, avoid this, or things like that. But one thing I personally I try to be aware of is that there are cravings. Okay.
Yes.
So siwezi kuambia, for example, kula carbohydrates. Na wewe in that pregnancy, hautaki kuwa na carbs. You can always now get it from another source.
Yeah.
So because hakuna food yenye iko na tu carbs pekee.
True.
Most of the time.
Yeah.
Okay. Ama proteins pekee. So at least your carbs, you can get it from maybe the protein source that you are eating.
Yeah.
Things like that.
So does it make your work easier when a pregnant woman walks in and she's knowledgeable of I'm in this stage of my pregnancy and I read this and this and this and this is what I'm supposed to take, because I feel like I feel like most pregnant ladies that I have interacted with, they just walk in the clinic, unachekiwa BP uko sawa, nini kunywa maji, BP pande juu, and then you walk na unaenda home. But most don't ask questions. Does it help your work to be easy? Yes,
it does. Personally hakuna kitu ni bamba kama patient mwenye anajua.
Yeah.
Because it becomes a discussion. It stops being a lecture.
Yeah.
Because a client will walk in and they tell you, vile umesema, very informed. I am 19 weeks.
Yes.
I've been niko na hii condition, I've been taking these drugs, or ama hata ako sawa. So daktari, what should I do?
Yeah.
It gets so easy because sasa unaongea from a point of unajua ataenda kufanya hivyo.
True.
Because another challenge is, yes, I'll tell the patient, please do this and that, and then they don't.
Yeah.
For one reason or another.
Yeah.
So inakuwa ngumu, but what will make things easier for all doctors out there, especially that deal with pregnant ladies, is wakianza clinic mapema.
Kwanza clinic mapema.
Anzeni clinic mapema. Kuna shida mingi sana tuta avoid.
Yeah.
If clinic wanze like ukianza clinic mapema. Juu ukianza tu vile unajisikia. I mean, for example, umeanza clinic because wacha umeona sasa unakaribia kujifungua. Uende tupate hata pressure ndio imepanda, or sukari iko juu, or you just notice some weird thing ukifanya scan, So anzeni clinic mapema. That is my hiyo ndo nitaimba leo.
Take home.
Yeah.
Anza clinic mapema.
Yeah.
Before hata conception.
Yeah.
Wow, interesting. Now there's this MP who said venye Kenyans wanapata watoto, we should ikue kwa rule, ni constitution or something, that we should only have 2 kids. Do you feel like or rather from your experience, do first time parents do they know nothing, or are they more informed right now compared of course to kitambo than the 4th time parent or the 5th time parent? So there's here neglect.
Wow. Okay. Generally speaking, first time parents now are a bit more informed. You can't compare like firstborn wa home, how your parents were wakiwa na firstborn and now, you know. So at least there's that. But one thing I'd like to caution parents is that, number one, each pregnancy is different. Each pregnancy is different. So you cannot compare pregnancy 1 to 2 or 3. Alafu, each child is different. So how they grow is different. Yes, delivery inaweza kuwa ilikuwa smooth, but then childhood ikakuwa tricky. Mwingine, the delivery was a nightmare. But then vile tu walitoka hivi, hawajaenda hosi. You know? So every pregnancy and every child is different. So I think that's, maybe, I don't know, have I answered vizuri?
Umejibu vizuri, but pia there's neglect. A first time parent, they walk to the clinic, the first time wameona two lines, tunaenda hosi. But when they get to their third born ama fourth born, ako like, si first born alikuja, second born alikuja, si ningoje, wacha ningoje 6 months niende nianze kunywa iron, because there's nini prescription from the chemist.
So umesikia kwa the plan tulikuwa tunaanza iron pre-conception. Iron inasaidia na development ya fetus. Ushesikia hii condition inaitwa cleft lip. Ni juu iron haikuwa. So iron haikuwa, kulikuwa na deficiency ya iron, so akazaliwa na cleft lip.
Okay.
Things like that. So si ati tunawaambia mkule msikule tiju tunataka. Ni juu there's backed up research. There are facts that if you don't do this, even dokutaka. All right. So if you don't want to listen, that's okay, but expect this. Sisemi ati lazima ifanyike hivyo. Kuna wengine by God's grace wamezaliwa na wako sawa, hata enda clinic, and that's okay. I mean, there are those instances, you know. But generally, let's stick to, first of all, let's be informed. Okay, it's better, by the way, read it on Google. Are you sure about it or not? Ni sawa, ambia daktari, nilisoma Google this and this and this. Could you please help me clarify? You know, instead of going to Google or ChatGPT or whichever search engine you want to use, and then ujitibu home. Fine, unaweza ukitaka, but then it will be good, just seek medical advice to be sure. You know.
Amazing, thank you so much. The last question, I think it's pondering my mind. There are continuous miscarriages. Might be you did not get checkup. Maybe you had a BP that was high, but most, I don't want to generally say this specific hospital, but anaenda hospitali, naambiwa hiyo imeisha, hapa denda nyumbani. Like kuna hospitali ziko hivyo. But the continuousness of miscarriage, what would you encourage? Because there's one comment yenye ilikuja 8 hours ago, ansema yake alifika 30 weeks and the baby left. Alikuja akiwa stillbirth. So the continuation of miscarriage, of course unajua hata unaweza ogopa kupata mimba ingine. Hata ukienda hiyo before conception to check up.
Now when it comes to miscarriage, first of all, it's usually a very sensitive topic to handle. But let's talk facts. Let's not go to nashuku. Facts, is there a disease? Let's tuangalia, tukifanya scan or do test, are we going to find something that's not okay? If we find, can it be corrected? Then tuna correct. If not, you know, then we'll discourage you from trying to get a child on your own. But most of the time miscarriage isipojulikana ni nini, ni hivyo haijulikani. Scientifically speaking, many times haijulikanangi. The mother is healthy, the pregnancy is healthy, the fetus is healthy, but inapotea tu. So we can't really know. You know, sasa hapo ndio people now start thinking outside science. Tunaingia into the spirit realm. Okay, God, kunaweza kuwa shida ni gani hapa? Because I mean, at the end of the day, ni Mungu mwenye anajua ni nini inafanyika, you know. And I also understand that there are other spiritual entities that may be at work, you know. So I wouldn't want to delve into the spiritual side since I may not have enough knowledge about it. But scientifically, if there's something wrong with your body and it can be fixed, then tunakupea solution, you know. But if not, we'll just discourage you from getting a child.
So it's best you go for a full,
just enda tu for a full checkup kwanza, ndo tujue si ati for example there's this condition with the cervix, we call it cervical incompetence, I think, yes, where the cervix just dilates mid-pregnancy, so mimba inatoka. So it can be corrected. So basically we just kind of tighten the cervix physically, all right, and then ukikaribia term we loosen the strings, you know, so that can be corrected. You see, sasa tumepata solution ya hiyo, but now sasa kama haijulikani,
tricky,
inakuwa shida.
Wow, thank you so much for honoring the invite kwanza.
Thank you for having me.
And thank you for educating our ladies. Najua we have a lot of questions. Na please, if you want to see him again and if you have any reproductive question, he will answer. Yeah. Thank you so much for coming.
Thank you.
Maybe
for
you can
having me.
encourage any mom out there who amekuwa na challenges za kupata mtoto. Patie hope.
This is what I can say. Don't let that desperation of getting a kid drive you to do the crazy things, you know. Infertility actually is a silent epidemic. Many couples are really trying hard to get kids, and inakuwa shida. What I can say is, first of all, let's start with the facts scientifically. Is there anything wrong? Let's get tested, both the man and the lady. Like we're in 2025, let's stop blaming. Let's stop blaming one partner. You know, sote tuende tukakue tested, tuone shida ni gani. And ikipatikana that for sure you guys are not able to have children, then don't just fixate on that. There's option of adoption.
True.
Okay, so at least there's that option. So please don't lose hope. Kabisa. There are options of getting a family. A family si lazima mkwe blood related. You don't, sometimes there's that adoption, there's that even adoption, all right. And then another thing with pregnancy, let me just nirukia to pregnancy kidogo. I'd encourage ladies who are pregnant, please be aware of your mental health. Have friends around, people who encourage you and you know, who are there to be your strength when you're feeling weak. I'd really encourage you to have such kind. And itakuwa poa ukiwapata even before the pregnancy. At least ndio watembee na wewe. You know, it will be hard to make friends during pregnancy your times, you know. So maybe that's what I can say.
Thank you so much.
Thank you so much for having me.
Barikiwa.
Nawe pia.